Hi, I'm Dr. Fernando Garzon, and I run the Society for Christian Accommodative Treatments and Programs. I run it with a great group of students here, and we're all about doing research on secular interventions and adapting them for the Christian worldview, and also drawing things from our own faith perspective. The Society for Christian Accommodative Treatments and Programs is all about developing things that may be in our field and adapting them for a Christian worldview. So, for example, mindfulness is a very big area. However, that comes from the East, Buddhism, Hinduism, and other Eastern religions. And so many Christians have concerns about that. However, two things. One, Christianity has its own rich history of meditation. You find the Psalms always talking about meditation. So we can take things from our own tradition, and that's one thing my research team does, is it takes things from our own tradition and it researches them. Now, another thing we do is we realize that most clinicians are trained in mindfulness, but not in different Christian meditations like Lectio Divina, for example. And so we also take things from secular mindfulness. So what we'll do is we start from a very different point. In mindfulness, you start with the present moment, which is your five sense experience. And then you also take whatever's going through your mind, your thoughts, any images, any current memories that you're thinking about. That's the present moment. But for Christians, we have another thing, and that is that God, in his immanence, is with us. So God is both immanent with us, and he's also transcendent. And so that changes the meditation. So we can take things like breath meditation, body scan awareness, other meditations, and we can apply a Christian worldview to really relate with God around our experience. So that's what we're doing right now. Now, what does that look like? So we're doing randomized clinical trials. We do a lot of Zoom-based group therapy with college students here at Regent University. And so the team is doing a randomized trial right now. And I have two students actually who are doing their dissertations from that randomized trial, which is real easy to do. You just take some of the measures that we're giving pre and post in the groups, and you analyze that for your dissertation. We've also had teams who've looked at our protocols because we develop these protocols for Christian accommodative mindfulness. And so some, for example, have translated it in Spanish. We've had one who's used it to work in a domestic violence shelter with domestic violence overcomers. And so there's lots of ways you can do dissertations. So if you join my research team, what would you be doing? So the first year, of course, you're going to be learning the meditations that we're using and researching. So you're going to be studying those, practicing those with our team members, but you're also going to have a part in the groups we run. We run psychoeducational groups. And what you're going to be doing is you're going to be the chat, what we call the chat champion. And that's the person who interacts on chat with group members. Now, another role you have too is that some would also be taking a look at the group, observing it. How are the group leaders doing? Are they covering the material we want them to cover? And so you would be actually doing what we would call protocol treatment integrity. So you would actually have a checklist that you would do to make sure that we're covering the things we need to. So first year is really important. You think, oh, I'm just learning. No, you're learning, but you're contributing to the groups in a very practical way. Second year, you're actually running the groups. So second and third years actually run the groups. You can participate in analyzing the data as well. And then the fourth year, they actually have a peer supervision in addition. So they do some of the training, and they also do peer supervision. So they're kind of supervising the groups, helping me do that. They can, of course, also lead a group session if they would like to do that as well. But lots of students really enjoy this progression from learner to actual supervisor at the end. So many different roles. And then, of course, we write articles on what we do. So we've already written one paper published in 2022. And we're going to be working on this randomized trial paper probably sometime next year when you're here. If you enjoy wellness, relaxation, health, well-being, and Christianity, come be a part of this team. I think you're going to enjoy it.